Did you know there are three types of Duane Retraction Syndrome and each one is exactly different and opposite to the other two? So do check out this video fully to know what are the types and how to diagnose them and their treatment. So Duane Retraction Syndrome, also called as Stilling-Turk-Duane Syndrome, is a rare congenital non-progressive strabismus with variable horizontal adduction deficits. It is associated with narrowing of palpebral fissures and globe retraction. So the etiology of this was thought to be mechanical disorder, so because of either tight lateral rectus or the dual insertion of the medial rectus, but the recent studies have shown that it is associated with congenital absence of sixth nerve nucleus. So because of this, there is aberrant regeneration of the third nerve which supplies both medial rectus and lateral rectus. Therefore, it is also called congenital cranial disinnervation disorder, CCDD. Coming to the genetics, so most of the cases are sporadic, while 10% are autosomal dominant CHN1 gene. So it affects the females in the left eye and usually unilateral. It has systemic as well as ocular associations. The systemic associations are seen in up to 30% of the cases, and these include radial ray anomalies like in case of Ocular syndrome and Holt-Oram syndrome. We also have head and neck anomalies such as in Goldenhar syndrome, Mobius syndrome and Welderwag syndrome. It is also seen in the cases of fetal alcohol syndrome and maternal thalidomide consumption. The ocular associations are ocular colobomas, morning glory anomaly of the optic disc, oculocutaneous albinism, microphthalmos, cataracts, and iris defects such as pupillary abnormalities, dysplasia of the stroma, and heterochromia of the iris. Coming to the presentation of the Duane Retraction Syndrome, most commonly there is limitation of the adductions, abduction more than the adduction, and esotropia more than exotropia. There is abnormal head posture and narrowing of the palpebral aperture, which is due to globe retraction, that is co-contraction of medial and lateral rectus. They can be upshoots and downshoots also. So in the image we can see the Duane Retraction Syndrome. So the patient is looking towards the right. There is defect in the abduction in the right eye, and in the left eye we can see it is narrowing of palpebral aperture. In the type 2 there is limited adduction and associated exotropia, you can see in the image. In the type 3 it has both adduction and abduction limited. So you can remember it as type 1 has 1D, type 2 has 2D, that is, and type 3 has 3Ds, 2 from adduction and 1 from abduction. The investigation is EMG of the lateral rectus, so which shows firing on adduction. The treatment in the mild forms is with the cycloplegic refraction, and mild head turn can be corrected with prismatic glasses. The indications for surgery include very severe AHP, strabismus and the upshoots. So the primary surgery is recession, that is weakening of ipsilateral medial rectus. If there is significant retraction, both should be recessed, or Y split of lateral rectus can be done. So for symmetry, the opposite side recession of medial rectus is performed.